Positive and negative predictive values. Hi, this is Dr. Peters, and I'm going to show you what the positive predictive value means. In one definition, the positive predictive value is the chance the patient has the disease given a positive test. So how confident are you with the result that you're given? So I'm going to use this for an example, a new influenza B swab. This is a hypothetical, as well as a hypothetical problem that I put together. So looking at the table over here, this is how the formula is put together. If you looked on the left-hand column, those who test positive will go in this column, and those who test negative. So this is for influenza. And so they picked 200 people in the study. They have 100 people that have flu symptoms. So you wake up and you have a high fever, body aches, chills, and a cough. And then they have 100 people with no symptoms at all. So I'm going to put 100 here because 100 have flu symptoms. And then I'm going to put 100 here because 100 do not have flu symptoms at all. And then they went ahead and tested the population. 80 people with symptoms tested positive. So 80 people with symptoms, that's right here, tested positive right here. So 80 goes in this column. And then 5 people without symptoms test positive. So 5 people with no symptoms test positive. So that number is going to go here. And the rest is easy to fill out because it has to equal 100. So those with flu symptoms had this new flu test swab done, tested negative. That would be 20 of them out of the 100. And those that do not have flu symptoms tested negative. So that would be 95. Then you want to add these together, 80 plus 5. And then you're going to add together the 20 plus 95, which gets you 115. When we're calculating predictive values, you're going to calculate on the horizontal level. This is different than sensitivity and specificity, where you are calculating using more of the vertical portion of the box. All right, so what we're going to do is we need to take the amount that tested positive that have flu symptoms. So you're going to put 80, and you're going to divide that by the total number of people that had a positive test. So that's going to be 85. So you divide that out, and the answer is 94%. So what does that mean? That means they have a 94% chance of having the flu. So you can be pretty guaranteed that if you have positive symptoms and you test positive, there's a 94% chance that you have the flu. And if you look at the other way, if you look at the difference, there's 6%. So that 6% means that you have a 6% chance that you won't have the flu. So really, if you're going to get tested with using this new method, 94% accuracy of having the flu. So when I ask the question, how confident am I with my results? When you give somebody a test result, whether it be a strep screening, mammogram screening, any type of screening test, if it's 94%, better being 95, 96, 97, 98, 99, nothing's ever perfect. You feel pretty confident when you leave that, yes, my flu swab tested positive, I'm feeling terrible, I'm sure I have the flu. You can feel pretty confident. Or if you're having just a low-grade fever, no cough, but yet you test positive for the flu, it's still 94% accuracy that you have the flu. You may feel like, wow, I'm not really having that many symptoms, but the flu test is pretty accurate, so I probably just have a mild case of influenza and testing positive for that. So that's a positive predictive value. It's used often to explain test results to patients. Now we'll look at the next page for negative predictive value, or NPV. What is negative predictive value? That's the probability the patient does not have the disease given the negative test results. So similarly to the last page, I set the exact same formula up. So we have 80 patients that tested positive and they have flu symptoms. We have 5 patients that tested positive but don't have symptoms. The negative predictive value is actually looking at this area right here. So those who have symptoms but tested negative are those who don't have symptoms and tested negative. So what is the probability that the patient does not have the disease given these negative test results? So first we're going to take the 95%. So first we're going to find out what percentage accuracy that is, that the patient really does not have the flu. And so you're going to take 95 and you're divide it by this number right here, 115, and you're going to get 83%. So that is the probability that this patient really does not have the disease. Or I should say flu, because you can use this for disease states too. Now let's do this. Let's try to find out what the percentage would be that they test negative, but really probably still have a positive test most likely. And that's when you take the 20 divided by the 115 over here, and you're going to get 17%. So that just means that if negative, they still could be positive for the flu. Because 17% really is a large number as far as looking at percentages and predictive values. So if you're having symptoms of the flu and you come in and have this flu swab done, and if there's a higher negative predictive value on that, I would say, maybe, and why does that happen? Sometimes you don't get that good of a sample, no different than a strep test. If you're trying to swab the throat, maybe they didn't get a good sample. So this patient, although they have symptoms, I would probably tell the patient, I'm really still suspecting the flu. Let's go ahead and put you on some Tamiflu. Try to shorten your symptoms a day or two maximum, and go from there. So I hope that helps you understand positive and negative predictive value. Another way to think about determining predictive values is, if the test is positive, how likely is it that you really have the disease, and how worried should you be? So if the test positive predictive value is high, that you have a biopsy done from your breast, how likely is it that you have the disease? So if it's high, you probably should be worried, because that positive predictive value is high. That's telling me that's pretty accurate of a test that it is positive. Versus the opposite, if a test is negative, how likely is it that he does not have it? How reassured should he be or they be? And another example, doing a breast biopsy and it comes back negative, how confident would they be if it tested negative? So if it has a high negative predictive value, that would tell me that this person would go home feeling pretty confident and much better that the biopsy came back negative. So here's where it can get confusing. What are the differences between sensitivity, specificity, and the predictive values? So sensitivity and specificity, that's actually talking about the positives that were correctly identified. So we're really just talking about the test being positive. Remember, go back to the table and you're going to be calculating vertically instead of horizontally. So actual positives correctly identified and actual negatives. Whereas the predictive values, it's more of a proportion of the patients with positive that are correctly diagnosed. As remember, going to the table, it was more vertical. So we took those that were positive and those that were negative, that tested negative. So you're actually finding a proportion, where sensitivity, you're just finding the actual positives identified versus the actual negatives identified. I'm just going to use one more example to show you the differences also between the sensitivity, specificity, and the predictive values. So I took mammograms to detect breast cancer. And so over here with the sensitivity, we're actually finding out which positives are correctly identified. So if we go back to that table here, and remember up here, positive is how many have the disease and those who don't have the disease. The side here is those who test positive and test negative. So these are people that have the disease right here. If you remember, we were doing the other tests, we had 100 and 100. But let's just say that we have 100 patients that have breast cancer, and they're trying out a new test to see how accurate it is. So these were people that were already diagnosed. So that sensitivity, let's just say it's a mammogram, the sensitivity is about 87%. So that just means 87% of those women or men that already have breast cancer will test positive for breast cancer. And the specificity is about 90 to 95%. So the actual negatives correctly identified. So we're going to do this count. So those who actually don't have the disease, what's the actual negatives correctly identified? Meaning, if you don't have breast cancer, you should test negative. If you have a high specificity, you should test negative. If you test positive, you're one of the rare 5 to 10% that test positive, even though you don't have breast cancer at all. Then if we go to the predictive values, you are doing it this way. So this is where you're determining the proportion. So the positive predictive value, if you're less than 50 years old, you have a 20% positive predictive value, which is not that great. So it's more accurate greater than age 50 because these are the actual proportions of patients with positive results that are correctly diagnosed. There's quite a few people that need to go further, especially if you're less than age 50, that don't have breast cancer that perhaps you suspect they could. So this could be a 30-year-old with a breast lump that could just be a cystic duct or a milk duct, and it ends up ultimately being negative. Whereas it goes way up to 85 to 90% when you're over 50 because your breast cancer rate goes up for a variety of reasons. And then the opposite would be if you take the difference, it'd be a negative predictive value. So if you see the negative predictive values, the proportion of patients with negative results that are correctly diagnosed. And it's very high for breast cancer at less than 50, and it is very low for that if you're greater than 50, age 50. I hope that helps.